Hi, welcome everyone. My name is Erin Calderone. I am a professor in the kinesiology division. I teach kinesiology classes and some health classes in PE classes. I'm hoping to teach tennis next semester as well, but I also teach the fitness specialist program for personal trainers and group fitness instructors. And I am joined by Kimbra Fossen from Knight Insurance Services. Kimbra, do you want to introduce yourself and tell us a little bit about you, what you do?
Of course. Hi, good afternoon, everybody. This is Kimbra Fossen. I'm from Knight Insurance Services. I am an insurance broker, and I've been in this business, I hate to say how long because that might give away my age, but over 30 years I've been in the insurance broker business. So I'm here to help and answer any questions, and anything else you have questions on, I'm here for.
Awesome. And thank you so much, Kimbra. I know I kind of put this together because I got requests from students in Health 104 for more information about health insurance. So the purpose of this presentation is supposed to really be an introduction to health insurance basics. It's foundational. And so if you have questions that you're kind of like, I knew this already, but I wanted to go deeper, like I said, we'll have a little bit of Q&A afterwards. And if you really want more information and us to go deeper into it, I'm learning as we go as well, but there's a possibility we could do more of this in the future. So let me make sure.
Erin, can
Yeah,
I interject for just a moment?
absolutely.
I know, some of you may have personal questions, something that's maybe a little more HIPAA compliant. If there's something personal you want to ask, you can call me anytime in the office. I'd be happy to help you. But you may not want to announce it, during this public forum. So
Awesome. All right, so I'll go ahead and move us along. And just as a reminder, if you just joined us, if you're a student looking for extra credit, please sign in the chat and include your professor's name. And if you are a faculty member looking for flex credit, please sign in and also give me your email address in the chat box. All right, so I'm going to go ahead and begin, and then Kimbra, if I make a mistake or I mislabel something, feel free to chime in and correct me. But first things first, we want to make sure that we're all on the same page in terms of health insurance terminology. We hear a lot of these terms talked about, and if you interview for a job and you get accepted, or you get offered that job, right? A lot of times they'll show you a benefits package, and you need to be able to understand it and interpret what that means. So if you get offered a benefits package, you want to take a look at what your options are and what you get with each of those options. So premiums, when we look at premiums, this is what you pay monthly. And you might consider this like a Netflix subscription. This is your subscription to health insurance. Now, this may vary depending on how many individuals are covered on your plan. So for example, you may have premiums for just yourself. And then if you also want family members to be covered, then that may be additional premiums. And depending on if you're getting employee or employer offered insurance, that may also vary as well. So this is really what you pay monthly, whether or not you're going to the doctor. This is like your subscription, right? Whether or not you watch Netflix, that's what you pay. Then your deductible is the total of what you have to pay before insurance starts to help out. So a lot of times this deductible is a limit for the year. You might also relate this to if you've had car insurance, for example. If you get into an accident, let's say, your deductible is, for example, $500, then if your damage to the car is less than $500, you'll be responsible to pay for it. But if it's more than $500, you'll only pay that $500 deductible, and then your car insurance would kick in on top of that. Well, it's no different for health insurance. It's just a deductible for the whole year. A copay is your portion of the bill to pay for each doctor's visit. And usually, correct me if I'm wrong, Kimbra, but a lot of times I've seen this as a whole number. It's like a certain number. It could also be a percentage though, correct?
it depends on the plan. Yes, you're correct.
So a copay, it might be a flat number like $40, right? Or it could also be a percentage of the total cost of the visit. But a lot of times you'll want to look at this for regular visits, things like checkups, might have a copay. Coinsurance is your percentage to pay once you've reached your deductible. So sometimes with the total for the year, you'll have a deductible that you'll have to pay for. And then after that deductible is met, then you and the insurance company still split the cost on top of that. So let's say that you had some medical bills, maybe that added up to $8,000 and your deductible was $5,000. So you had met that $5,000, right, deductible. After the $5,000, the remaining three, perhaps your insurance works like you pay 30%, they pay 70%. So you would still have to continue paying after the 5,000, but it would be that percentage of co-insurance that your insurance company would also start paying for. Now, another term is out-of-pocket maximum. This is the maximum you pay for the year, not including premiums. So a lot of times they'll also have an upper limit to that, even with co-insurance, and say, you'll never pay more than this for the entire year. And that's important to pay attention to, especially if you have several procedures coming up and you may want to schedule those procedures within the calendar year so that if you've already reached your out-of-pocket maximum, you don't have to pay for those in the next year, adding up to that next year's out-of-pocket maximum. So you can kind of, for some people, this might be something to look at to make sure that they, if they've already reached their out-of-pocket maximum, to really maximize the kinds of things that they can get for that calendar year. Kimbra, did you want to add or correct anything that I've said here?
No, I was just going to elaborate just a little bit, because usually when you have co-insurance and co-payments, it depends on the plan you have. So most of the time, HMO plans have co-payments. So Kaiser is an example of an HMO. So most of the time, you won't have a deductible, but you'll have co-payments for certain things. And then if you have a PPO type of plan, that's usually where the co-insurance comes into play. So there are different kinds of plans, and each of these would apply to different kinds of plans that you might be available to you.
That's actually a great segue to our next page, which is about the general different kinds of health insurance plans. So Kimbra mentioned HMO versus PPO. And I remember when I first got a full-time job, I was wondering, and got benefits, I was wondering what's the difference, because I didn't know these different acronyms. And even when you spell out the acronyms, sometimes it's confusing. So an HMO is a health maintenance organization, and a great example of that is Kaiser. And actually, Kimbra and I were talking about this before everyone came in, and I said Kaiser's like the Costco of health insurance, because it's like a one-stop shop and you have everything there, right? So there radiology's down the hall, you have pediatrics over here. It's kind of like this central place, and everyone is within that. A PPO is a preferred provider organization, and this includes more choice. So you get to choose your doctor rather than going to Costco, right? You might go, buy something at Trader Joe's and then, something at Ralph's or something like that, if we're using our grocery store analogy here. So that's really the main difference between HMO versus PPO. With an HMO, you go to one place, really, one organization, and they have everything. You're locked into that. Whereas with a PPO, you do have the freedom of choice to go find a different specialist or go find a different doctor, or, go to your doctor for years and years, even hopefully for the rest of your life, right? And choose which doctor that you want to have. Kimbra, did you want to add anything to that?
No, Erin, you're awesome. We're going to offer you a job here at Knight Insurance Service.
So one of the differences to think about is out-of-network versus within-network medical providers. And so with a PPO, if you're going and searching for a new doctor, typically you want to look for one that is within the network, because usually that doctor will have the best options and they're accepting that insurance, right? And so your out-of-pocket will probably be less. Is that correct, Kimbra?
Yes. Um, I can elaborate just a little bit on that because
Please.
when a doctor is contracted under a PPO, what they've done is they've agreed to charge you a lower fee. So say their office visit normally is $350. So what they've done by contracting with whatever insurance company is, they say, no, we're only going to charge you $200. So you would pay your percentage of that $200 instead of the $350 because they've negotiated that with the insurance company. Does that make sense?
Yeah. So they have a deal with the insurance company if they're within that network. If they're outside that network, that doesn't mean that you can't go visit that doctor, but it's likely that the charge will be more and your percentage will be more, correct?
Yes.
Okay. So then another thing to look at when you're looking at benefits is what is covered, and to look at whether or not copay or coinsurance is different depending on these different things that are covered, right? Preventative care, so this could be regular screenings and checkups. How many doctors, like regular doctor office checkups, do you get per year, right? What about labs, x-rays, hospital stays, any surgical procedures? Prescriptions are another one to look at, and you might want to look at the difference between brand prescriptions or generic prescriptions, especially if that's something that you know that you need to take on a regular basis. If you're planning on having a family, you might also want to look at prenatal care, labor and delivery costs. Some organizations also offer some like ancillary services, or they might coordinate or cover partial ancillary services, things like health education or health coaching, or I think some were doing things like chiropractic and stuff like that. Kimbra, do you want to
Yes.
add?
Yeah. It depends on the plan and it depends on what you're offered. There are all different kinds of things that could be offered in your package, and chiropractic might be one of them. Mental and nervous benefits are included. There's just all kinds of things. So you want to take a close look at the plan summaries and what's called the summary of benefits and coverage that outlines what you would pay for certain things.
Exactly. Now we have options to change plans, but typically we can't do that throughout the year unless we have a significant change to our lives. Like for example, when my daughter was born, she was born in July. Typically open enrollment period when I would be able to change my plan wouldn't be until October or November. We're actually in open enrollment for a lot of insurances right now. And because she was born in July, that's a significant life event, right? And that qualifies for me to add her to my insurance program, okay? Barring that, I couldn't really change it until open enrollment. So there are some specific situations where you can change your insurance plan, but typically they use this period of time, this open enrollment time, to make those changes, and then that goes into effect for the next year. And right now is open enrollment. And this is for group or for individual plans. So let's say, for example, if you have a spouse and they have insurance and you get a new job and maybe that insurance coverage, you like that better, then this would be that period of time where you could switch over to the new insurance that you wanted to go with. Another thing to look for is coverage outside of the general health or medical coverage. Things like dental and vision are usually separate plans. And so are things like life insurance, long-term disability insurance. What else, Kimbra, are usually offered as separate packages?
There's also voluntary life is another one. So if the company offers life insurance to you and they pay for that, they also sometimes offer voluntary life, so you could purchase more insurance if you don't feel that's enough what they're paying for. So you can buy more. There's also sometimes separate chiropractic services that you could buy as an option. And there are also things like Aflac. I'm sure you guys have seen those Aflac commercials, and those are called ancillary benefits, and they cover things like accident, hospital stays, things like that. So that might be an option for you as well.
Yeah, definitely something to think about. And for some folks, they found that, thinking about long-term care or things like if they get in an accident or they have an illness that takes them away from work for a long period of time, that might be something to plan for if you might need that type of insurance. And those are typically offered separately.
Yes.
So where can we get health insurance? Well, we often get health insurance through employer group benefits full-time, and sometimes companies offer part-time benefits as well. There's also a place that you can go purchase your own, and you can also see if you might get financial assistance as well through Covered California. I think that what I last heard was that if a family member received unemployment benefits because of a loss of job due to COVID, then there's a lot of financial assistance available. It might be as low as $1, but there's you have to provide evidence of that, right? And so there's a process to go through Covered California to get those benefits as well. And you can also compare and contrast some of the plans that they have in Covered California and what they offer. Then there's Medi-Cal, of course, as well. And then you can also just go directly to the carrier and purchase individual medical insurance directly with the insurance company that you want to go with. Kimbra, did you want to add?
Yes. One thing I just wanted to say about that for the group benefits, not all plans have a January 1 effective date. So I know the college does have a January 1 effective date. So their open enrollment is in October, November to be effective January 1. But other companies out there may have a July 1st effective date or an October 1st. So open enrollment may be at different times depending on the company if it's a group benefit. And for the Covered California, I just wanted to let everybody know it's a lengthy process as far as completing your application and things. For Covered California, basically, they are asking for your salary and your life history to see if you qualify for subsidies from the state of California. So that's why it's sort of a lengthy process. But if you go through that, and sometimes people make too much to be able to qualify for Covered California, they may offer you Medi-Cal instead, depending on what happens when you fill out that application. So they might direct you to a different way. They may say, okay, you qualify for Covered California and here's your subsidy, but you don't qualify for Covered California, so here's your Medi-Cal. Or you may qualify directly to go to an individual medical. I know it's very confusing, but if you start with Covered California, they will guide you through what you're eligible for. And I know it doesn't make sense until you see it, but they will guide you, and it's a helpful website actually.
So what you're saying is when you sit down to do it, make sure you have a couple hours that you can, gather everything, put all the information in, and, get some guidance on where to go and what's offered to you.
Yes. W-2 information is something that they will ask for. So it's, make sure you have all that kind of stuff in front of you when you sit down to do that.
Great idea. So what about what's available to students in terms of healthcare? We have a health center, and a lot of colleges and universities have health centers with free or low cost health options. So for example, what we offer here at the health center at GCC, obviously is first aid to anything, for anyone that has an accident or something happens on campus. TB testing, and some of us are required to do TB testing maybe for working with kids, or you might have a TB test requirement. They do have immunizations. So I know right now they're offering COVID-19 vaccines and flu vaccines as well, actually on campus. And you don't need an appointment. You can just walk up and get it. You can go through the link on our website and check that out. They're offering a Pfizer vaccines if you're curious. They also offer mental health counseling and crisis intervention. And then sometimes they offer some really special opportunities as well. So sometimes they'll have interns come to campus who need hours for the career that they're going for in their education. And these have it varies throughout the semester, but we've had interns for nutritional counseling. So students who are planning on becoming or studying towards their registered dietitian licensing. And then we've also had marriage and family therapist interns who've come to campus and provided either, nutrition coaching or counseling types of services. So even though we always have access to mental health counseling and help at our first aid, basically at our mental first aid center on campus, we also have some special opportunities sometimes. So always be looking out for that, typically during the regular the semester, spring and fall. And then for the Garfield campus, Margaret Mansour also put together a list of community resources, and I know that she's updating that right now. So I will make these slides available and you can link directly to that page. It was extensive. I noticed she really put a lot of effort into this and really putting together all these different resources that are available to students, especially at the Garfield campus. And doesn't matter what type of insurance you have, whether or not you do have insurance, there are a lot of different resources out there. So that's really great. I will, again, like I said, I'll give you the link, but also just go check up that website because I know she's updating it. Other resources for GCC students, if you are worried about medical bills that you might have, there's also a COVID-19 emergency grant program that you can apply for. And that grant could be for healthcare costs, it could be for other costs that you've experienced over the last 18 months, has it been? It's an emergency grant program that you can apply for. We also have the food pantry available, and we were doing drive-through, a mobile food pantry, but you can also just go to campus if you make an appointment and pick up free food and toiletries. And then there's also a community resource finder through the Help Finder, and it varies what you need. They have some resources. You just pick what you're looking for and you can find some resources there too. So I wanted to hand it over to Kimbra actually to talk us through some really common scenarios that a lot of people have questions about. So go ahead and take it away, Kimbra.
Okay. Well, I tried to put some examples in here that would sort of make sense. We were talking about, how a copayment works. So this is an example of somebody taking her son to the pediatrician, and this is an HMO plan where she has a copayment at the doctor's office. So there's no deductible to meet. There's nothing for her to pay except her copayment for the visit. So normally that cost of the visit, that doctor would charge $200. But because Sally's covered by insurance, she pays her $15 copayment and that's it. That's all she owes. The health plan pays the difference to the doctor. So that's a pretty simple example of how an HMO type of plan would work. This one, we were talked about this earlier. There are some healthcare reform laws now that are in place, and they cover annual physicals and your exams, annual mammogram, unfortunately colonoscopies as well, that kind of thing. Annually at no charge to us. If you're on an HMO or a PPO, it doesn't matter because any of those preventive services are covered at no charge. So this example shows the cost of a physical and the cost of the mammogram, but because the new healthcare reform laws, there was no charge to Mary. The health plan pays the whole thing and Mary pays nothing. So if you're ever going in for an annual physical, it should be at no charge. Now, one of the things I just want to mention really quick, if you go in for your annual physical, so you make your appointment, and then you get there and you say to the doctor, oh, I've been having these terrible headaches, and then that visit is not an annual physical any longer. You are now there because you have an issue. So if you say something like that during your exam, you will still have a copayment and it won't be covered under the healthcare reform laws at no charge. I hope that makes sense, but we have had that happen quite a bit where people are saying they went in for their annual physical and then the doctor charged them, and that's why.
That's good to know. We know it's important to let your doctor know if you are experiencing something,
Yes,
but that
yes.
maybe that's a separate visit. I don't know.
And you can certainly do that all within that visit. You just have to know that at that point it would no longer be considered your annual physical. So
Got it.
So the next one is sort of a coinsurance example. So this would be more than likely under a PPO type of plan. So, it kind of gets a little complicated if you have several services done. But in this example, John has a second surgery in that same year. So say their plan is January to December, like the colleges is. He has a second surgery in the same plan year, and it costs $3,200. Now he's already paid $800 toward his annual deductible because he already had services done. So he's responsible only for the first $200 of that second surgery to meet that deductible. I hope that makes sense so far. And after that, now he's met his deductible. So his $1,000 deductible has been met during this second surgery. And the insurance carrier pays 80%. So in this particular example, he has what's called an 80-20 plan. So the insurance company pays 80, the member pays 20 after the deductible is met. So you see John met his deductible and the remaining balance is that 80-20. The carrier is going to pay $2,400 and then John would still owe $600 of that remaining balance. So that sort of is what Erin was talking about earlier, where you have coinsurance and you have to meet your deductible first. And this is an example of that.
So John shouldn't be surprised then if he gets a bill for $800 because the first part of that is meeting his deductible, and then the second part of that is that 20%. Sorry, I didn't mean to go backwards.
Right.
Is that 20% his coinsurance? But then he's not responsible for the full $3,200, right? The insurance company is paying the rest of it here.
Correct. And anytime you have to pay, like this is a PPO example. So he would receive what's called an EOB. That's an explanation of benefits. And that shows what he has paid, what he owes, what the insurance company is paying on his behalf. And so all of that should match up with the bill that he receives for the surgery. So if something doesn't match, that's when you question, don't pay anything until you know what you're being billed for.
Yeah, good idea. And great to get that explanation. And if it doesn't match up, maybe call and say, hey, I need a more explanation of these charges here.
This one I put on here because we do have this happen a lot with ambulance services. So if an ambulance picks you up, they will take you to the nearest hospital. Doesn't matter if it's Kaiser, if it's not Kaiser. We've had this happen quite a bit, and the ambulance doesn't ask you for your insurance information. They don't have time. They're taking you where you need to go. So more than likely, you will get a bill from that ambulance service. And what you need to do when you get that is send it into the insurance company so they know to process that. Because again, the ambulance service doesn't know who you have. They may also ask you, they may send you a letter and say, please let us know who your insurance is so that we can bill them. It just depends on the service. But when you get that bill, if you ever are taken in an ambulance, which I hope you're not, but don't panic. That just means that they haven't submitted it to insurance yet. Okay. And then if you have PPO coverage and we talked about this a little bit too, and you use doctors or hospitals that are not contracted, the doctor and the hospital can balance bill you for services. So anything that the insurance doesn't pay, they may send you a bill for that additional cost because they're not contracted, so they don't have to accept the contracted rate. So they may bill you for those differences. And that's why we recommend people try to stay in network, because then you'll receive those discounted costs that we talked about earlier. There's also some services, and this has happened quite a lot lately for some reason, but they need to be pre-authorized. So if your doctor says you need to have certain things done, MRI is a good example. Those doctors, those surgery centers or anything should know that they need to be pre-authorized. And what happens then is the doctor, the surgery center, whoever, will submit that to your insurance company, and then they get the authorization. And you shouldn't have the services done before you get the authorization. But once it's authorized, then the doctor should call you and say, okay, we have the authorization, come on in and get your services completed. So some of that stuff's important, and every contract is different. So some services that would need to be pre-authorized under one contract may not need to be under another. So just be careful with that if you're being asked to do an MRI or a CAT scan or something of that nature.
Great. Good to know. Thank you. All right. I think that is it for our presentation. Unless you want to add anything else, Kimbra?
No, I would love to hear if anybody has any questions or if there's anything I can do to help answer anything.
Yeah. So to that end, I'm going to go ahead and stop recording.